Our project evaluated the effectiveness of peer-to-peer education on patient-centered outcomes, specifically primary DEXA scan rates for osteoporosis screening. As a family medicine residency program at the Cherokee Nation in Tahlequah, we strive to fulfill our health system's mission to partner with individuals, families, and communities to improve health and quality of life. In alignment with this mission, our quality improvement project aimed to determine whether a peer-to-peer educational intervention could improve adherence to nationally recommended screening practices.
We focused on osteoporosis screening using DEXA scans, a Grade B recommendation by the U.S. Preventive Services Task Force for all women aged 65 and older across 9 Cherokee Nation primary care clinics. Our intervention was the Best Practices Presentation Series introduced in 2022 by our program director, Dr. Dustin Beck. These sessions are held twice monthly during the lunch hour and are designed to help residents develop scholarly skills while reinforcing current clinical guidelines for care teams. Our objective was to evaluate whether a best practices presentation on osteoporosis screening increased DEXA scan ordering rates. In phase 1, we found no significant increase in screening rates across all clinics. However, there was a 13% increase in DEXA scan orders within the resident clinic. Several limitations should be noted. This was our initial analysis of DEXA screening rates, and participation in the educational sessions varied across clinics. As a result, we were unable to fully assess the intervention's impact at a system-wide level. Although peer-to-peer education is widely recognized as an effective teaching strategy, our findings did not demonstrate a clear impact on patient-centered outcomes overall. However, the increase observed in the resident clinic, where most participants were exposed to the intervention, is encouraging and suggests that the effect of peer education may become more evident with broader participation, repeated interventions, and longer follow-up.
This leads to phase 2 of our study, where we will assess whether repeating the best practice presentation after adding specific modifications further improves screening rates. We will also examine downstream outcomes, including fracture prevention and potential reductions in healthcare cost. Primary care providers play a critical role in prevention. As clinical guidelines continue to evolve, peer-to-peer education may serve as a valuable tool to keep providers informed and support the delivery of evidence-based whole-person care.